Romania is battling its worst COVID-19 wave yet. Why the suspicion over vaccines isn't helping. Bucharest, Romania, CNN. It's relentless. Child nurse Claudio Lonita standing in front of the line of journeys in Bucharest University Hospital's morgue. On each gurney lay a body inside the black plastic bag. The morgue has the capacity for 15 bodies, but on the day CNN visited, it had received 41. The excess bodies filled the corridor outside, while wails echoed from within the morgue. A woman had been allowed inside for the final glimpse of her father. Bucharest University Hospital is the Romanian capital's largest medical facility treating COVID-19 patients and is struggling through the country's fourth wave, its worst yet. I never thought when I started this job that I would live through something like this, said Lonita. I never thought such a catastrophe could happen, that we'd end up sending whole families to their graves. Several floors above all the beds, but one in the hospital's now expanded extensive care unit were full. A nurse was changing the seat on the one vacant bed, empty, because the person who occupied it now lay in the morgue. Romania has one of Europe's lowest vaccination rates. Just under 36% of the population has been vaccinated, even though the country's vaccination campaign got off to the good start last December. Medical workers and officials attribute to this low vaccination rate to the variety of factors, including suspicion of the authorities, deeply held religious beliefs, and the flood of misinformation surging through social media. Dr. Alexandra Muntin, featured at the Palatu Corfilo vaccination center in Bucharest on November 16, is ready to vaccinate as many people as needed, if only they would come. When Dr. Alexandra Muntin, 32, arrived for duty at one of Bucharest's vaccination centers after an overnight shift in hospital, she found the turnout was low. She is perplexed that the gravity of the disease just doesn't seem to have sunken in. There are lots of doctors, myself included, who works with COVID patient, and we're trying to tell people this disease actually exists, she said. One of the country's most vocal and high-profile anti-vaxxers is Diana Sosoaca, a member of the Romanian Senate. In one of her many public stunts, she tries to block people from entering the vaccine center in her constituency in the northeast of the country. If you love your children, stop the vaccinations, she said in the video clip on her Facebook page. Don't kill them. The vaccines on offer in Romania has been extensively tested for use in children and have proven to be safe and effective, but that hasn't stopped her and others from spreading wild rumors on social media and local television. Officials and medical personnel were exasperate that public figures have done so much to undermine their effort. Look at the reality, said the core doctor Valeriu Georgita, an army doctor who runs the national vaccination campaign, who have our intensive care unit full of patients. We have lots of new cases. We have, unfortunately, hundreds of deaths every day. So this is the reality. And more than 90% of patients who died were unvaccinated. A banner in Bucharest shows medics working on COVID-19 patients with this message. We are suffocating. We are begging us. We are regretting. In the Bucharest, a huge banner has gone up, covering hot the parquet of a building on the major blood. They are suffocating. They are begging us. They are regretting. Are the words printed in massive black letters above a black and white photograph of medics struggling over COVID patient in the intensive care unit. Down below, a few passers-by glance up at the poster, and even fewer cared to share their thoughts with CNN. Soon, however, that banner will go up in other major cities in the country. There's manipulation, said the woman who gave her name only as Claudia, adding, some people don't believe in the vaccines. Mayor, it's not a safe vaccine. Nowhere is that suspicion more apparent than in the countryside, where COVID-19 vaccination rates plummet to about half of those in urban areas. Suceava County, an hour's flight northeast of Bucharest, has the lowest overall vaccination rate in the country. Here, the manager of the main hospital, Dr. Alexandru Kalansia, 40, talks about the particularity of this region where he was born and bred. This county is very religious. This is an area that has a strong religious tradition and lots of the religious people. Very few priests are pro-vaccine, and I definitely know some who are anti-vax. Most of them choose not to say anything either for or against. We have proof from the hospital, from patients who come from the same religious communities, where their priest or their pastor has advised them to not get vaccinated, just like that. Just outside the Suceava, in the village of Bosanci, such a pastor also served as the village mayor. Nikolai Miron has been one of the most vocal anti-vax public figures in the country, and today is no different. We are not against the vaccination, but we want to verify to satisfy our worries because there have been many side effects, he told CNN. We don't think that vaccine components are very safe. It's not a safe vaccine. Nekwari Miron, mayor of the village of Bosanci in Suceava County, is vocal about his views against the vaccine. He thinks it's not safe. The medical data doesn't sway him, and neither does the local GP whom he took the CNN team to see. Dr. Daniela Apadaruan administered the vaccines to about 10 people every other day using the Johnson & Johnson vaccine. The latest official records show that just under 11% of the village was vaccinated as of early November 2021. While she talks about the situation in the village, the mayor, Milon, hovered about the doctor's desk, peering down at the papers on her desk to see what had been vaccinated. When are you going to get vaccinated, Mr. Mayer? Asked Avadarwa, laughing. I don't need to get vaccinated, he shot back. I'm perfectly healthy. The doctor's explanation that the vaccine helps to keep you that way fell on deaf ears. Pastor, I believe what I see rather than what I hear. The rural villages like this, poverty and lack of education, together with the local leaders' personal influence and in traditional religious beliefs, can make for a deadly combination. But the local Pentecostal pastor, Dragos Kroitoru, insisted he was unaware of any deaths from COVID-19 in the parish. Here in the church, we don't have any cases of people who are sick with coronavirus. We have a 0% mortality rate. I don't know anyone who's died of coronavirus here in our parish, and I believe what I see rather than what I heard, he said. Despite hearing from CNN about the bodies of COVID-19 victims filling the morgue at Bucharest University Hospital, Croitoru was unconvinced. Bucharest is bigger than Pozanti, as far as I know, she chuckled. We haven't had any deaths. Maybe we've had a few people who have been ill in the village. Yes, as far as I know, yes. But the mortality rate in our church has been 0. The mortality rate is certainly high elsewhere in this mostly rural county. Suceava ranked third highest in COVID-19 mortality rate for the whole country as of early November, according to figures from the Public Health Unit, which monitors death. Flashly laid graves at the biggest graveyard in Suceava on northeast Romania, which has the third highest COVID-19 mortality rate in the country. A corner of the main cemetery in Suceava, the county seat that's about 10 minutes from Pozanti, is full of flashily dug graves. In the cemetery's chapel, a service is underway. On the hill behind the chapel, mourners gather for a funeral. Nearby, another grave is being prepared. The wooden crosses over each new grave don't indicate the cause of death, so it's unclear how many died from the virus. A man walks on one of the graves, however, said the number of people being buried of late was far higher than usual. Eternal regret reads a ribbon dropped across one of the graves. Back in the morgue of the Bucharest University Hospital, the medic hammered a nail into a wooden coffin. The colleague sprayed the coffin with disinfectant. For those who died of COVID, there will be no open casket funerals. The vaccine means the difference between life and death, said Lonita, the nurse. People should understand that. Maybe in their last hour, they should understand that. For those shrouded in the black body bags before him, it's already too late.